my name's Joyce Gibb, and received an email from a listener, and this is the email. My son is 45 and was diagnosed with urethra melanoma last week. He has not seen his doctor since diagnosis. His next appointment is July 24th to discuss a plan of treatment. Most likely there's a pending radiation and chemo in his future. I wanted to know if vitamin C in large doses would help him to prepare his body for the onslaught of chemo and radiation. A friend of mine just went through something similar, and he said that he did want to try to help his body up by using vitamin C. Thank you. So what I would say, first of all, of course, he has to follow through with his doctor. I'm sure that's how he got the diagnosis of urethra melanoma. And why does that happen? That's the first thing I would say. Why are men getting bladder cancer more than women? Why, it's the urogenital tract. And so why does this happen? You can't help but think that there's environmental toxins that are contributing to all of this. Melanoma is through sun exposure, typically. That's what you usually hear. And to have melanoma of your urethra, that's, not as common as what you typically would think. So we're exposed to all these different chemicals, radiation and glyphosate, which is Roundup, and all the different pesticides, herbicides, and everything that's in our water. And how our body deals with that or detoxifies, mainly, of course, is done through your liver. So, but one of the things that here at the medicine shop, Ask Joe DiMatteo, we have a collaborative agreement currently right now. It's called Cellcore Biosciences. And one of the things that you can do is, talk to me about, this person could call and say, what should I do about this? How can I get my body ready? Yes, I do think that vitamin C in high doses, it upregulates your detox pathways. So that will help the radiation and the chemo. And you certainly should not do vitamin C on the days of chemo and of radiation, because there's some school of thought that potentially that being an antioxidant could kind of minimize the chemo. So that's one thing that we always said, was just don't do it the day of chemo or the day of radiation. But there are some people that do IV vitamin C. IV vitamin C does definitely help with different types of cancer, specifically melanoma in the urethra. Not so sure about that, but just especially cancerous tumors, and there's IV vitamin C you can do. Without that, though, one of the things you can do is high doses of vitamin C powder. One that we have actually has and I'll get it here just a second. This buffered C, it actually has, it's a high dose in a teaspoon. You put it in water, and you dose to bowel tolerance. So what's that mean? If you start having loose stools, you back off on it. Many people, as it upregulates detox pathways, it also increases your immune system. So it does many, many things. And like Joe used to always say, if I would be on a desert island, what one nutrient would I want with me? And it would be powdered vitamin C, because you can do so much with it. It has so many aspects of your body that it helps. So with this person, I talked about the cellcorebiosciences.com is who we have this collaborative agreement with. And one of the things that they have, there's nothing else like that for detoxification. It's called Virad Chem Binder. And the dose on there is 2 twice a day. If you would like to do part of that protocol for detoxification, please call me, because there's a lot of other things that we can do with that. So, for this patient, high dose vitamin C to bowel tolerance, and you put the powder in 2 to 3 ounces of water. It fizzes. It has it's effervescent that it comes to. Wait till that's finished fizzing, like Alka-Seltzer, then you drink it. And actually, our vitamin C is from beets, and it tastes citrusy. Doesn't taste like beets, and that is something that you definitely could use, after chemo, after radiation, just to help your liver process all the toxicants that happen with the chemo and radiation. So if you'd like to talk to me further about this, I'd love to help you on your journey to health. So give me a call. Thanks a lot. Thanks for watching. If this information was helpful, hit that thumbs up button down below. If you want more videos like this, hit the subscribe button down below, then ring the bell next to it. Also, if you know other people that you would want to share this link with, please do so. because I would love to help them on their journey to good health.